everybody, and welcome. We're so excited to bring you a short interview with one of the presenters at the Alliance for Massage Therapy Education Educators Congress happening this summer, this July in Tucson. And my friend Tara McManaway will be the pre-convention speaker this year, and I'd love to just tell you a quick little story about how I met her. So last year, I was teaching a class in Washington, D.C. called Touching the Mind, Mental and Mood Disorders for Massage Therapists. And it was a day that we spent talking about depression and anxiety and several other things. And right at the end of the class, as I was sort of wrapping things up, I put up a slide about a program that I had discovered while I was preparing for that class, and the program is called Mental Health First Aid. And I said, I haven't had a chance to take this class yet, but boy, it looks like it would be really, really useful. So keep your eyes open. And as it happened, completely by chance, Tara, who was one of the participants in that class that day, is in fact a presenter and educator for Mental Health First Aid. And it was just a wonderful sort of stumbling on of happy circumstances. So when it came time for the Alliance for Massage Therapy Education meeting, I was really excited to see that Tara had applied to be one of our presenters and was chosen to be the pre-convention meeting. And what I'd love for you to do now, Tara, is to just introduce yourself a little bit and then talk to us about why people should plan on coming to Tucson a day early to get to this class. And I will preface that by saying I am absolutely getting to Tucson a day early to take this class.
Excellent. Good. So I just give you a little background. I am a mental health provider and have been licensed since the late 80s, and also a massage therapist, and discovered mental health first aid actually because I triaged a couple of students with anxiety attacks in the hallway, and I noticed that people were walking right by them and nobody was stopping. And I said, okay, wait a minute, I'm using my mental health background to help these students. They get test anxiety, they get a number of stressors, and I said, somebody else has to do this because I keep getting pulled out of class. And so I said, what's out there? And then I discovered serendipitously Mental Health First Aid, which comes out of Australia, and it is evidence-based, and it took a little bit of doing for us to get permission to get trained, and there are 2 people on my campus who do that, and I have been running training since 2012 and training massage therapy students as well as other educators and other people in mental health first aid. And the main reason that we do this is because, particularly on a college campus or in classrooms where we're teaching massage students, the 18 to 26 year age range is the time when we begin to see mental health disorders rear their heads. And the early symptoms, we see 75% of them happen in that age range. And so it's our student population, it's our and early intervention is really, really critical to keeping people from having a really difficult battle with mental health disorders. So, and also, as a massage therapist, when you created that program that I attended on mind and body and mood disorders, is that they impact 1 in 5 people, and they impact our clients exponentially because we're all about wellness. Our clients are coming to us looking for ways to feel better and feel well, and often they have undiagnosed mental health disorders that nobody's recognized. And they talk to us sort of like bartenders. They tell us everything, and they often tell us things they've never told anybody else. And so we're right on the front lines to be able to use the mental health first aid listening skills to be able to listen non-judgmentally and then get them pointed in the right direction to get help and assistance.
So, I'd like to just interrupt you there for a moment because, for someone listening to this who doesn't know you or me, what you're describing might sound like a really serious breach of scope of practice, right?
Correct.
The idea of recognizing and diagnosing mental health disorders in a student population. So can you say more about what?
I can. So regular CPR in our minds is not outside of our scope of practice, right? If somebody had a heart attack or needed the Heimlich maneuver, we're trained, and so we would intervene. And mental health first aid is just like that. We're not training you to be mental health professionals. We're training you to be the first responder if you will, the people who look for and recognize the issues and then provide, intervention and referral, not therapy, not treatment. We provide the help until the professionals arrive. And so an anxiety attack, you might call emergency services while you're waiting for that anxiety attack to resolve. And so we're really not talking about working out a scope. We're talking about doing CPR for mental health.
Mm-hmm. Mm-hmm. And truthfully, if we think about for our teachers, where are you more likely to be on the scene, right? For someone having a stroke or a heart attack, or for someone having an emotional outburst.
Right, yes, or just beginning to recognize, like our students in the classroom, they can't quite get the work done. Well, maybe it's a low-grade depression, and it's been unrecognized up to that point. And so appropriate for our faculty and students to say, okay, wait a minute, we need help. Where are the resources in the community where we can get help for that? So it is really important that we recognize those things, because it's a student success issue. It's a client health and wellness issue. And it's also, and I'll go back to your scope of practice, it's a scope of practice issue, because I will also hear a number of massage therapists think that they can cure mental health disorders by simply doing this move or that move or this technique. And the fact of the matter is that we may be very helpful, but we're not the right professionals to be doing it alone. And we need to be able to work with mental health professionals to be able to provide the symptom alleviation that our clients really need when they come to us.
So I have one final question, and then we really need to wrap up. But in your class, will you speak at all about how people giving some guidance about how to put together a network for referrals?
Yes,
maybe
absolutely.
Some ideas about how to identify the best professionals in your area that to sort of get on your Rolodex, so to speak?
Yes, absolutely. And actually provide a handout for higher education that gives people an idea of where the resources are, some of the online resources, as well as the emergency resources, the crisis hotlines, and the community core services, and those kinds of things. A lot of times, if our students are eligible for financial aid and Pell Grants, they're also eligible for a number of resources that on federal and state level that will help them get mental health services too. So there are a number of things that are, you just get in the know. And I think you will use mental health first aid almost every day, as opposed to CPR where you hope you never have to use it.
Right. Well, I'm thrilled, and I'm so glad that you were chosen to do this pre-convention class. So it's this is a good time, if you're listening to this interview, to get your tickets, get your hotel room, but make sure that you arrive a day early so you can join Tara McManaway and Mental Health First Aid with a special focus for massage therapy and massage therapy educators.
Excellent. Very good. Thank you, Ruth.
Hey, thank you, Tara. Thanks so much for taking the time.
Yeah, bye-bye. Good to see you. Bye-bye.
You too.